Hello friends, I am Dr. Utsa Basu. I am a consultant physician and diabetologist from Kolkata. I am currently attached with Horizon Lifeline Multispeciality Hospital. So we are all going through a very difficult situation nowadays in this pandemic situation. So as far as we know about this COVID virus, that it affects mainly those who have certain comorbidities. And most important silent comorbidity is hypertension. So let us talk about some certain key points about hypertension. First of all, what do you mean by hypertension? Every minute our heart is pumping out blood. So the blood goes through the blood vessels. The pressure that the blood vessel gets from the blood on its lateral wall, this pressure is called blood pressure. Normally the blood pressure ranges around 130 by 80. But in certain condition, it can cross to up to 220 and 120 diastolic. And in certain this type of conditions might precipitate some critical medical illnesses like stroke, heart failure, cardiac arrest, etc. So coming to the risk factors of hypertension. These risk factors can be divided into two topics. One is that can be reversed and one is which cannot be reversed. Now coming to the non-reversible risk factors. What are those? First is the age of the patient. We can't reverse the age. Whatever we might try, but age cannot be reversed. Second is family history. This is also a non-reversible risk factor. These two are the main key non-reversible risk factors. Then comes ethnicity. This doesn't cause too much of high risk, but it is also considered to be one of the risk factor of hypertension. Now coming to the risk factors that might be reversed. These are all dependent on our lifestyle. What are those? First of all is our lifestyle, means exercises and what type of physical activities we are doing. Second is addiction. Main addiction that we are facing are tobacco. Tobacco is a very important risk factor that can be reversed. Then comes the alcohol addiction. Alcohol is also an important factor which causes a significant rise of our blood pressure. Then comes our next are the eating habits. What type of food we are taking. This type of mainly what happens, the food which are rich in sodium content that are we usually taking what are the junk foods mainly. So these junk foods are also a very much important risk factors for hypertension. This all can cause a rise of BP in a significant amount, which might be linked to other disorders also. But the silent thing is that it silently rises our blood pressure. So what we need to do? First of all, we can modify our lifestyle. And we should also follow a healthy eating pattern that should contain sodium content that should be restricted in restricted quantity, and we also should cut down our junk food intake. Then comes physical activity. At least 1 hour of physical activity is mandatory on a gross way. It also depends on what age limit the patient might be. So 1 hour of physical activity is the basic requirement. Then we should all cut down our addiction, mainly smoking, then for alcohol. Stress is also an important risk factor for hypertension. We should also focus on how to manage our stress level. If we can't do it on our own, we can consult a physician or a neuropsychiatrist to help, and also go for some counseling sessions also, so that we can also control our stress limit. So what my advice is, you do follow whatever your doctors do, but you need to regular check up your blood pressure level, so that whatever the complications linked with hypertension, we can avoid them. So routine checkup of BP is mandatory. Second is you follow your prescription. Don't skip your medication which your doctor prescribes you. Do follow a healthy lifestyle, including a healthy eating pattern. Improve your physical activity, and please cut down your smoking and also restrict the use of your alcohol. Stay safe, and I hope you will be able to at least control your hypertension by doing some small things. Thank you.